Hello, my name's Marie. I'm one of the fourth year medical students at the University of Leicester. Can I confirm your name and date of birth, please?
Sure, so it's Harvey Thompson, 10th of May, 1996.
Okay, that's great, thank you. So today, Harvey, I've been asked to do a hand examination on you. So that's just going to involve me having a look at your hands, having a feel, and asking you to do some movements. Is that alright with you?
That's fine.
Okay, that's great. So I'm just going to wash my hands. Okay, Harvey, would you be able to lift up your arms for me and just place them on this pillow? That's great, thank you. And are you in any pain at all today?
That's fine.
Okay. So first of all, I'm just going to have a look at your hands. So would you be able to turn your hands over for me? That's great. So I'm just looking for any muscle wasting. I'm looking for any scars or any swellings or any redness as well. Okay, that's fine. Would you be able to turn them over for me? That's great. Okay, so I'm looking for any muscle wasting, any nail changes, and any swellings or any redness. I can see there's a wart on the index finger of the right hand, but there's nothing else of note. That's great, thank you very much. Would you be able to lift up your arms for me? Like that? That's great. So I can't see any rheumatoid nodules or any plaques or any toe fly as well. That's great, thank you. Okay, Harvey, so now I'm just going to have a feel of your hands. And you said you're not in any pain at all today? No. Okay, that's fine. So I'm just going to have a feel for the temperature. Temperature same on both sides. You'll just turn your hands over for me. Good. Temperature same on both sides again. So first of all, I'm just going to have a feel of this hand. But before I do that, would you be able to put your hands up for me? I'm just going to have a feel for the back of your arms. That's great, thank you. So no nodules there. Okay, Harvey, I'm just going to have a feel of your hand now. All right? Let me know if you're in any pain at all. So feeling along the metacarpals. I'm feeling the anatomical snuff box. Any tenderness there?
No.
Okay. Just going to have a squeeze of your knuckles, looking at the patient's face, see if they're in any pain. That's fine. So now I'm just feeling the joints. Do I have any feel for any crepitus or any stiffness? Okay, Harvey, would you be able to turn your hands over for me? I'm just going to have a feel of your palm. So I'm feeling for any muscle wasting, any nodules, or any Dupuytren's contracture, which there doesn't seem to be. That's great, thank you. Okay, Harvey, I'm just going to ask you to do some movements now for me. So would you be able to put your palms together like this for me, and then raise your elbows up as far as they can go? That's great. Any pain at all?
No.
And would you be able to put the back of your hands together and then push your elbows down? Back of your hands together. That's great, thank you. And now would you be able to move both your hands out to the side and then back in again? That's great, thank you. So now I'm just going to have a feel and just relax for me. So I'm feeling for any crepitus. I'm just going to do the same with the knuckles. That's great, thank you very much. Okay, Harvey, I'm now going to test the sensation in your hands. So I'm just going to place this cotton wool on your chest just to show you what it feels like. Can you feel that?
Yep.
Okay, that's great. So now I'm going to ask you to close your eyes, and I'm going to place this cotton wool on different parts of your hand, and let me know if you can feel it and if it's the same on both sides. Okay?
Yep. Yep. Yep.
That's great. Would you have to turn your hands over for me?
Yep. 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 Yep.
That's great, thank you very much. Okay. Now, would you be able to put your fingers out like this for me, and then stop me from pushing them down, and then push my hands away? That's great, thank you. Now spread your fingers out, and stop me from pushing them in. That's great, thank you. Now turn your hands over for me, and place your thumbs up to the ceiling, and stop me from pushing them out. That's great, thank you. Okay, Harvey, so I'm just going to have a feel of your finger. I'm just going to press down on it. Right. So capillary feels normal. And I'm just going to have a feel of your pulse. Is that alright? So turn your arm under. Thank you. That's great. So the pulse is regular. So now I'm just going to ask you to pick this coin up for me with your thumb and your forefinger. That's great, thank you. Can you do it on the other side? That's great, thank you. And are you able to undo your top button for me and then do it back up again? That's great, thank you. Okay, Harvey, would you be able to turn your hands over for me? So I'm just going to tap on your wrist and let me know if there's any pain at all.
No pain.
No pain? Okay. I'm going to do it on the other side. No pain?
No pain.
Okay, that's fine. Now I'm just going to ask you to put your thumbs onto your palms like this and put your fingers over. I'm just going to move your wrist. Let me know if there's any pain.
So no pain.
No pain? That's fine. And same on the other side?
So no pain.
No pain at all. Okay, that's fine. So thank you for letting me examine you today. You can get yourself ready.
That's fine.
I'd complete my examination by doing a full neurovascular examination of the upper limb and examining the joint above, which is the elbow.
Okay, thank you.